Hi, I'm Kevin Mullin, and this is One-on-One. My guest on this edition of One-on-One is Stacey Wagner. Stacey's a familiar face to us here on Peninsula TV. She is the Director of Public Affairs for Kaiser Permanente here on the Peninsula. So, Stacey, we had you on a while back on One-on-One and back in January, and you said that you look forward to coming back to discussing the San Mateo Medical Office Building. So where are we right now with that project?
Well, we're very excited. Back in January, the San Mateo City Council unanimously approved our project, so we're excited that we get to move forward.
Excellent. So have you started construction yet at that San Mateo Center?
Yeah, not just yet. We'll be doing some site-ready work beginning at the end of April, and then we'll officially break ground in July this year.
And when will it open?
We'll begin seeing Kaiser Permanente members for outpatient services by December of next year.
Excellent. So you mentioned the outpatient services. Will you be building a hospital as well as part of the complex?
No, we will not be building a hospital, so we will not provide emergency care or inpatient or hospitalized care. Our members will still need to go to Redwood City or to South San Francisco for a hospital or emergency care.
Right. So when you were here last time, you were talking about the new hospital as well for Redwood City. So where do we stand on that project?
Yes, that project we're also excited about. We'll be building a new hospital to replace the existing hospital, and that hospital will open sometime in 2014.
Very good. So back to the San Mateo facility, what kinds of services will be offered at that San Mateo Center?
That's a great question. We'll offer a wide variety of primary care, including adult primary care, pediatrics, and OBGYN services.
Any other services beyond those?
Yes, for added convenience for our members, we'll also offer a full pharmacy, optometry, and full optical sales, general or digital radiology, mammography, a clinical lab, and other lab services. We feel that it's pretty much one-stop shopping for most member needs.
Great. And where will the San Mateo Medical Office Building be located for our San Mateo and Mid-County to South County residents interested here?
Yeah, we worked really hard to find a convenient location. It's going to be located right off Hillsdale Boulevard, off Highway 101. It's a gateway to the city of San Mateo, across from the police station and the Whole Foods Shopping Center.
Was it difficult finding a location in San Mateo that works for all of your needs?
You know, it actually was. I mean, we've also faced that challenge up in South San Francisco, because at the time, you know, there wasn't a lot of land available. I mean, it looks different now, but you know, you want to pick a spot that's going to work well and is well positioned for your members.
So why San Mateo? Just on the natural, it seems you've got Redwood City covered and South City covered, so San Mateo is a nice central location. Was that the primary reason you chose San Mateo for the new facility?
Well, a couple things. Our mission is to provide high quality care and affordable care for our members, and also to improve the health and wellness of the communities that we serve in addition to our members. If you look at San Mateo, we have close to 50,000 members who live in and around the city of San Mateo. So finding a location that was convenient for our members who live in that area was first and foremost in our mind.
So Kaiser has something of a reputation for being an innovator in the industry, and that has carried over somewhat, I think, to the green building practices and sustainability practices. So I would imagine the new building in San Mateo will have green features as well.
Correct. We'll promote a wide variety of alternative transportation programs, such as public transportation access with BART, bus, shuttle service, fuel-efficient vehicles, car and van pools, and of course bicycles. And if you look at the landscaping we're going to put in, we're going to be using native and drought-tolerant plants, which will reduce the water use by 50%. The structural steel framing will contain 75% recycled content. The ceiling tiles will have 55% recycled content. There will be natural ventilation in the public and waiting areas. And the wastewater from building operations and high efficiency fixtures will be reduced by 20%. I mean, that's just a small snapshot. I know there's a host of other things, but we'll leave it at that.
Right. So even as we speak today, as we're doing this taping at least, there is a senior health fair going on in my community in the city of South San Francisco. And tell us a little bit about that fair. It's too late for folks watching this to attend, but how that event came about, and talk a little bit about some of the other events that the organization is involved in coming up.
Sure. This is the 13th annual Senior Health Fair. Kaiser Permanente has been a longtime supporter with the city of South San Francisco, and there's a wide array of services that are offered to seniors in our community. There's free health screenings, there's health awareness information, diabetes, nutrition, pharmacy, skincare. The sun's coming out, it's been real nice. We want to make sure we're putting on that sunscreen and keeping, our bodies out of the sun. Stroke and heart health. I mean, there's all kinds of services. It's only for a one-day event, but it is the 13th annual, and we're proud to support that. I know you've also had Supervisor Carol Groom on talking about the Streets Alive program, and I know that Sharon Reynolds will be talking about South San Francisco's participation, and this is a perfect event for us. I mean, there's a lot of Thrive-ish activities that'll be happening. It's essentially don't use your car that day. It'll be on Sunday, April 11th, and we'll be supporting it up in South San Francisco, down in Redwood City. I'm hoping we'll be able to support in San Mateo as well. And our concept is we're going to be bringing out our educational theater program, the kids course. It's a giant display that gets kids moving. It promotes physical activity, eating, 5 or more servings of fresh fruit and vegetables. We're going to have our samba dancers out. I don't know if you've ever done the samba. It's very...
I have not, Stacey, but if you want to teach me someday.
Well, I haven't either, actually, but it's a lot of fun. We've had the samba dancers at our Employee Wellness Festival in Redwood City. It's very high energy. We think it's appropriate for the Streets Alive program, so I'm hoping to see a lot of people up trying to learn the samba. And we think it's going to be a lot of fun, and we're glad that we're going to participate.
Right. So this whole Streets Alive movement, it's very exciting, and I was curious to see how different communities are embracing this. We're talking about some lifestyle types of changes in terms of getting people moving, and I know that's really the message of your organization and the whole Thrive kind of concept. But getting people moving, dealing with obesity issues, becoming healthier, and I know that cities, for example, are trying to at least look at building a health component into their general plans and creating walkable communities, and that health piece is really central now to land use and how cities grow and cities develop. And I would imagine Kaiser really has a stake in seeing communities adopt these kinds of innovative approaches toward health.
Absolutely. I mean, it's about being aware the type of food choices you're making. I mean, it's unfortunate in some communities where they don't necessarily have access to fresh produce. Families are working multiple jobs, and so fast food is sometimes their option. But if we really think about, the healthy food choices we're making, if we're getting exercise, I mean, our parks are free. You can go to the park, you can walk, you don't have to join a gym and spend a lot of money. You're right, Kaiser Permanente is about, wellness and prevention. And it's interesting because I talk with some of our physicians, and, some people are willing to make the changes necessary to have a healthier lifestyle, and some are not. Some want a pill, and it would be, better for an individual in the long run if they could take better care of themselves and make healthier food choices and get a little bit more exercise, because they'll live longer and have a healthier life and essentially thrive.
Sure, and it makes terrific sense, and I know certainly from the industry level and the policymaker level, this is the direction we're moving in. The question is the public really adopting these kinds of things? And I certainly know segments of the population are, but we certainly hope that it's a broad kind of movement, and folks are really embracing it. So we are running short on time. I wanted to thank Stacey Wagner. She is the Director of Public Affairs for Kaiser Permanente here on the Peninsula. Thank you very much once again for joining us on the program, Stacey. This has been One on One. I'm your host, Kevin Mullin. We'll see you next time.